Have you ever suffered from the winter blues? Do you wonder why your energy and motivation change as the seasons change? It could be seasonal affective disorder. Today on Health Minute, presented by Hallmark Health, we're going to talk about SAD, seasonal affective disorder. It's more common than you think, and we'll get tips on how you can treat this condition. Today I'm joined by Dr. Alla Goldburt, a family medicine doctor at Hallmark Health, and we're going to talk about seasonal affective disorder. It's also known as SAD, correct?
Exactly.
What is that exactly?
Great question. So there are so many ups and downs of the holiday season, so it can be sometimes difficult to separate just the occasional seasonal blues from true seasonal affective disorder, which is a pattern of a reoccurring depression that happens with almost every winter season, more common as people get older, and something that actually affects their daily life, affects them more days out of the week than less, and interferes with sleep-wake cycles, interferes with your appetite, interferes with your mood in a way that makes people more irritable, more aggressive, and can get to the point where it actually interferes with everyday life, that people don't feel confident or motivated to take care of themselves, their family, to get through a regular school day or a work day, and can actually be quite debilitating.
Okay, so you did bring up a good point. There's winter blues, which I think some people or most people may experience, but then there's something a little more serious. What are some of the red flags that may indicate that this is more than just the winter blues? It's something more serious.
Sure. So if the irritability and the change in mood and motivation are impacting people's performance in school or in the workplace, their ability to care for their family or for themselves, especially if those changes in mood are also starting to kind of create thoughts of hurting themselves or being better off not being alive. So those are certainly red flags that will warrant a check-in with your primary care provider or your healthcare provider.
What are some of the triggers besides the time change and it getting darker in the winter?
So the seasonal blues can be triggered by any of those things, but true seasonal affective disorder is definitely a change in the circadian rhythm based off of the changes in the light patterns. And so that's one of the reasons that light therapy is one of the most effective treatments for seasonal affective disorder, and typically recommended as a first-line treatment for anybody who's suffering from the seasonal depression.
What about medications? Anything like that?
That's a great question. For people who don't respond to light therapy, they may actually benefit from a mood medication. First-line mood medications for seasonal affective disorder are the same ones for classic depression. It really is considered a depressive episode. And it's really important the habits that you pick up prior to bedtime, or the habits that hopefully you can ditch prior to bedtime. So screen time, caffeine, alcohol, that nightcap that you may think can help you turn off can actually create a really disjointed sleep. And when you are sleeping, creating an optimal sleep environment. Cool room, dark room, white noise in the background if you need it, and then using that artificial sunlight as kind of part of your dawn awakening can really help regulate your sleep-wake cycle. And most importantly, I think, is being active during the daytime, moving your body. It's a great source of stress relief, and it's great for an overall healthy lifestyle.
Dr. Goldberg, thank you for all this very helpful information. We really appreciate you joining us today.
Thank you.
For more information on seasonal affective disorder, visit the website below.